Well, let's turn now to the pandemic and begin here with a group of 5 Canadian long-term care home operators who are really joining the growing list of companies that will require all staff to be fully vaccinated now. The policy aims to prevent another deadly wave of the virus in long-term care settings. So for more, let's go to Hilary Johnstone. She is on the story for us today. So talk to us about this new policy, Hilary. Just exactly how's it meant to work?
Michael, these companies say that they will put their workers on unpaid leave if they can't prove by October 12th that they are fully vaccinated. So this is going to apply not only to current workers, but also new hires, students that might be going and working inside these homes, any personnel who's going to be going and working inside these homes. And this is Chartwell, Extendicare, Responsive Group, Revera, and Sienna Senior Living. So a couple of really big names in the long-term care industry that have all signed on to this letter. And in a statement, what they're saying is that they know infection levels are going up and that unvaccinated staff pose a big risk to residents. So in part, they say, quote, "The safety of our residents in long-term care and retirement homes who trust us to provide the care and services they need is paramount. This policy will increase their level of safety and improve quality of life for residents by reducing the need for isolation and disruption of daily activities that result from outbreak restrictions." And Michael, earlier this year, there was a study that found that Canada fared the worst when it came to deaths inside long-term care homes during the pandemic compared to a number of other countries. Some 69% of all the people who died in the earlier waves of this pandemic from COVID in this country died inside long-term care homes. And it's important to point out that the majority of the homes in Canada are for-profit private companies. And those are just a few of them that have signed on to this agreement. So quite significant that they are saying that they will be mandating that their workers be fully vaccinated.
So talk to us then about how this is actually going to fit in, because we're now looking at this patchwork of vaccine mandates across the country. How does this fit into that puzzle?
That's right. So if you take British Columbia, for example, as of October 12th, so the same date, all of the workers inside long-term care homes in that province, they're going to need to be fully vaccinated. So really these companies just sort of getting on board with what we've seen some other provinces do. Ontario does have a policy that's going to come into place on September 7th, but it's really more about if employees don't want to be fully vaccinated, then what are the alternatives, including making sure that they go to education sessions, for example. But the other thing that we are hearing, Michael, from some experts is that they fear there could be some unintended consequences when it comes to staffing levels because of vaccine mandates. Let's listen rather to that.
I understand the impulse. We do want healthcare workers to be vaccinated. I want every healthcare worker to be vaccinated, especially the ones who work with vulnerable populations. But again, it could come back and bite us if we end up eliminating a whole bunch of people that could otherwise help, especially at a time that we need it.
And Michael, just finally, a hospital workers union recently did a poll of all of its staff and found that almost a quarter of them said that they were thinking about leaving healthcare within the next 2 years because of some of the experiences they've had during the pandemic. So some fears that, this policy could be quite controversial to some people, and that there are fears that that could cause even more people to leave the industry at a time when we are dealing with both burnout and a possible fourth wave.
Okay, Hilary, thank you for that. Our Hilary Johnstone.